My name is Johnny Bluestar, and I assist Dr. Hugo Rodier, an MD with an integrative medical perspective, the host and founder of the Integrative Hermetic Health Show. Despite our mandate as a health program, we cannot avoid mentioning the brutal and disturbing treatment of Julian Assange, which is now a struggle for his life itself. This is a focus that all alternative media should be involved in. Julian Assange, who has become an icon of press freedom, who has exposed multiple transgressions of our political establishment, war crimes, and other abuses of government, and is being punished by the very perpetuators of those misdeeds he has uncovered. In his prison confinement and now in his hospitalization in a medical wing of HM Prison Belmarsh, he has been subjected to unmitigated psychological torture, according to Nils Melzer, the UN Special Rapporteur on torture, which undoubtedly has been one of the several factors that may have impaired his health to a critical point. We would like to point out, as a kind of analogy, the sad fact that for many years there have been related efforts to repress information in the field of health and other areas in which the corporatocracy creates profit by exploiting the public's lack of knowledge. When people are subjected to unneeded pharmaceutical products and unnecessary surgical operations, along with experiencing the financial stresses involved with the high cost of the practices, as well as the further stresses of not having insurance to pay for hardly any of their health needs, then they are too subject to tremendous pain, psychological damage affecting their health due to stress, and the possibility of loss of life due to all these factors. This type of suffering can be clearly compared, in scale at least, to a kind of physical and often psychological torture due to the uncertainty and lack of proper care. Much of this suffering is due to the repression of the kind of information that we present in this program, which deals with natural prevention and cures for many of the drugs that are offered to the public that merely overlay the symptoms and do not address the causes of certain health conditions. You can address health conditions if you manage to look for or stumble upon the right answers. In this program, we also return to our analysis of some of the most important new research coming out. This involves the discovery that ketamine appears to spark the growth of neural connections that have been diminished by chronic stress. Ketamine has been primarily used as an anesthetic in medical practice, but has also been abused as a recreational drug. It has recently been approved by the FDA for the use of a nasal spray to combat depression. In another article related to depression in older people, it was found that those who adhere to a Mediterranean diet also found that they were less susceptible to developing that omnipresent condition of depression in our society today. In regards to older people, another article warns about the use of acetaminophen, major component of Tylenol and other medications. This study strictly found increased risk for stroke for nursing home residents who had diabetes. We also discussed such important, more practical topics as the importance of dietary fiber in a healthy diet, going into the details of exactly how that is explained in an era of microbiome science. In another dietary-related article, researchers have found that men who eat more meat are subject to premature deaths. Dr. Rodier's comments and explanations follow. Join us on this show, Health Information Repression, and the latest reports on useful medical studies.